So why is there bleeding in early pregnancy? Is it normal or is it dangerous? Seeing blood in early pregnancy can be terrifying. You might be asking yourself, is this normal or am I losing my baby? Many pregnant women experience some bleeding or spotting in the first trimester, and it is not always a cause for panic. In this video, we will explain when the early pregnancy bleeding is normal and when it could be significant danger, so that you know what to do when it happens to you. I am Dr. Archana, fertility specialist and laparoscopic surgeon, Pinnacle Fertility, Nizamabad. Here in India, I have met many expectant mothers who get terrified and alarmed by the early pregnancy bleeding. I understand how scary it is. So today I want to reassure you with all the clear information. So in this video, we will talk about why bleeding happens in early pregnancy and what is normal, what is abnormal, when it is serious, when to take it not so serious. So the first thing to know is bleeding or spotting in early pregnancy is very common. It happens in almost 1 in every 4 pregnant women in their early pregnancy. That means almost 1/4 of people experience this spotting and bleeding in the early pregnancy. So why does it happen? So there are many reasons for this spotting in pregnancy. Few might be very minor reasons and few might be serious issues. So when coming to the minor issues, the first thing which comes to mind is implantation bleeding. So I know you might be hearing about this implantation bleeding very frequently. So implantation bleeding is something which happens when the embryo implants into the uterine lining, that is endometrium. So usually it happens around 8 to 12 hours after the ovulation. After the implantation happens in the tubes, the embryo will be migrating from the tubes into the uterus, and in the uterus the embryo does the trophoblastic invasion. So it just penetrates into the endometrial layer. So due to these small ruptures and breakages happening at microscopic level, there might be spotting or minimal bleeding that you experience, which is completely normal. So usually this implantation bleeding is brownish to reddish brown in color, which is totally normal. You need not panic much about this. So the second reason for the spotting in pregnancy could be cervical erosion. Again, this is due to the hormonal changes that happen during pregnancy. Due to the high levels of estrogens, the cervix becomes very vascular and becomes very sensitive. So during this time, there could be a possibility that you develop something called cervical erosion. Usually the patients with cervical erosion, they experience post-coital spotting or post-coital bleeding, which usually happens after having a sexual intercourse in pregnancy. So even this one is very minor thing. You might experience minimal spotting or very minimal bleeding, which you might not require any pad support also. So the other reasons for bleeding in pregnancy are quite serious and dangerous. The first one is ectopic pregnancy. Ectopic pregnancy is something we call when the embryo implantation occurs outside the uterus, either it be it in the tubes or in the ovaries. So in this case, the patient experience moderate to heavy bleeding. Along with the bleeding, you will have abdominal cramps, and some patients even experience dizziness and fall in the BP. So in case you experience any of these symptoms, immediately I advise you to take your doctor's consultation. And second important cause for bleeding in pregnancy is subchorionic hematoma. I know many of the patients who have twin pregnancies usually experience this more. This happens when the placenta grows as the gestational age advances. As the baby grows, the placenta also grows with the baby. And at this time, when the placenta grows, the blood vessels around the placenta also grow. And at this time, some blood vessels again might rupture, and there might be chances that you can develop a hematoma or clot. Usually patients with subchorionic hematoma experience mild to moderate bleeding. It's required that you take your doctor's advice immediately, so that the doctor might start on some hematinics, some medicines to resolve your clot. And also we advise complete bed rest to patients with hematoma, because there could be chances that this hematoma might increase in size, or which might lead to miscarriage or abortion. Also we advise that patients with subchorionic hematoma take a simple antibiotic just in case, to prevent any infections and any leakage of your membranes. The last but most important cause for bleeding in pregnancy is miscarriage. So whenever you experience heavy bleeding with abdominal cramps, if you require multiple pads to change in an hour, definitely one thing should come to your mind is miscarriage or abortion. So I request you immediately consult your doctor, take the necessary medications and take all the necessary measures to stop the process of abortion. So how do you differentiate normal spotting from dangerous bleeding? So spotting is usually normal. It's just a few drops or a light smear of brownish or pinkish blood. It doesn't even feel like you need a pad. It just fills your panty liner or doesn't even fill the panty liner. You might occasionally see it when wiping also. So no abdominal cramps, no signs of dizziness. So when do you need to concern about the bleeding? When it is bright red in color, when it is enough to soak a pad, or continuous flowing, especially if it is accompanied by menstrual like cramps, or even worse, sometimes if it is accompanied by dizziness or passage of clots or tissue like products. No matter what, always inform your doctor, and if you experience bleeding during pregnancy, even if it is minor, it's always wise to take the advice of your gynecologist. So when you visit your gynecologist, they will always take your history. They will ask you about the amount of bleeding, about the color of bleeding, how many pads have you changed and all, and even they request you get an ultrasound done. And in the ultrasound, we look for the condition of the baby, whether the heartbeat is there or not, and what is the cause for the bleeding, whether it is subchorionic hemorrhage or it is ectopic. So the important thing is don't panic. Earlier said than done, I know, but remember, so many women who experience minimal bleeding in pregnancy or spotting in pregnancy, they even go to the term and deliver a healthy baby. While you shouldn't ignore it, you should also assume the worst. Stay calm and follow your doctor's advice. So in summary, bleeding in early pregnancy can be normal or dangerous. Light spotting, especially minimal spotting or minimal bleeding, is usually harmless. It can happen in almost 1 in 4 pregnant women, and it might just be an implantation bleeding or small cervical erosion. Heavy bleeding or with painful cramps and associated with other symptoms like dizziness might indicate a serious problem like ectopic or miscarriage. So when in doubt, always check it out with your doctor. It's always better to be safe and get professional reassurance or care. Remember, staying calm and informed is your best bet. Stress isn't good for you or for the baby. I hope this video eased your worries. If you found these insights helpful, please hit the subscribe button. For more doctor to patient related videos on pregnancy and fertility, share this video with other expecting moms, and feel free to leave a comment with any questions or topics you would like me to cover. We are in this journey together. Take care and see you next in the next video.